I'm Sai Siva Gorthi, working as professor in the Department of Instrumentation and Applied Physics at Indian Institute of Science. We intended to have a new paradigm of in vitro diagnostics, which is like taking the whole lab to the primary health center level. While that is being quite ambitious, we wanted to take at least one test and demonstrate that on the platform and take it all the way to impact the society. So that has been our vision and passion. And that is where the context of SickleCert has come into genesis. So the technology name is HPOS, High Performance Optical Spectroscopy, and SickleCert is the reagent or the kit that enables doing the sickle cell anemia testing in the point of care settings. A doctor by name Dr. Nishan, who has been working in Homeopathy Medical College and University, Bhopal, Madhya Pradesh, has read an article that we published, journal article, on an earlier invention on optofluidic microscopy, wherein spherocytosis and sickle cell potential of doing sickle cell has been published. And he approached and explained the challenges he has been facing in the field. They were doing some pilot testing of 10,000 sickle cell population, tribal population and tribal community are being screened, and they are facing a lot of challenges, lack of point of care confirmatory test, and then need for a large volume of blood to be collected and shipped, and the cold chain to be maintained, and logistics and the time gap, and then incidences where even by the time the report is finally taken back and traced out the concern, they have already passed away. Such issues have been faced, and he has given the specifications and requirements and asked, would you be able to develop something that can do from small prick and drop of blood at the point of care. Cost should be quite affordable and so on. So that's where we started and took it as a challenge, and whole of our research team then came up with this invention of HPOS. Especially in these deep science technologies, the gaps are quite huge that in fact most of us won't even be able to cross. The amount of either funding or the number of human resource and the extent of efforts that needs to get into to be able to really translate a deep science technology that to in middle space domain to a product level which passes through regulatory and all other requirements to be able to offer are quite a significant quantity and extent that often we get support only for very small bits and pieces, and thereby we won't be able to really reach and fill those gaps. The kind of recognition for the efforts that have been getting into such technologies which are of quite relevance to society is something that has had a significant impact, and that recognition has helped in terms of spreading that awareness in the community, and then the relevant both scientific and technical and other aspects of in terms of translational, commercial, manufacturing. So across various sectors, this recognition sort of helped in building a good network and brought in multiple people excited about the possibilities, and thereby helped significantly in terms of translating from sort of a small scale initial version of the product prototype to a manufacturable prototype. There are so many things which are involved, reader and for an instrument or a device, whole lot of things. So and then for a reagent and a whole lot of other things and so on. So if we look at the overall assay and product to be brought out, which is of the international standard and fulfills the quality requirement, it's a significant effort and time and the resources. The extent of moral support and the recognition for the efforts in working in such domains and then bringing that connect in a way indirectly quite a significant boost that it offers, because we already lined up multiple other tests to be performed in different locations, and really taking it to the society and market was planned. We tied up with a manufacturing partner, and then they gave from the marketing and manufacturing point of view few other requirements based on the mass scale testing that needs to be, the combination needs to be used, and then we had to change version of the SickleCert as well. The entire journey again, but it's kind of done in a much shorter span with much more rigorous steps that we have utilized the prize money in terms of field validations to be done not on very small number of samples but sufficiently large number of samples, and make when doing field camps, running field camps, getting the lot of feedback in terms of its usage and improvising and fixing that come across, and getting the validations and support in terms of these organizing the camps and so on is the prize money has significantly helped in terms of field validations to be done not on very small number of samples but sufficiently large number of samples, and make when doing field camps, running field camps, getting the lot of feedback in terms of its usage and improvising and fixing issues that come across, and getting the validations and support in terms of these organizing the camps and so on is where the prize money has significantly helped in terms of meeting those requirements. For getting those sufficient validations done to and field camps to run to gain the feedback, the prize money has helped. SickleCert is having a device, and then there is a reagent kit. Into it, having that reagent is loaded into this reader, and that gives the classification whether the individual is normal or sickle cell trait, which means a carrier but not having the disease per se. And then the third category is which is a more severe manifestation of the anemic condition of the sickle cell anemia. So this classification gets displayed on the device and then also gets pushed to the cloud. And this reader itself altogether, which meets the quality requirements and regulatory requirements and offers a reliable classification, is developed by us. And then in terms of that is something, a significant change that has happened. When people testing in semi-skilled people are testing in the field, if they skip certain steps, immediately it flags or recognizes. So various things. So app analysis and then the reader put together is developed. So that is a significant difference in the one at the time of Aarohan versus post currently as of today, 198,700 tribal population in 3 districts of Karnataka, Mysuru, Kodagu, Chamarajanagar, have been tested with SickleCert, and of which over 300 to 500 have been identified, over 100 SCD patients, and then over 500 to in fact maybe 1,000, close to 1,000 SCT have been identified, carriers. An year back, in fact, the project started in March. An MOU was signed between Indian Oil Corporation under its CSR initiative with Indian Institute of Science and the Karnataka government, Health Department, Government of Karnataka. All 3, Government of Karnataka, IC, Indian Oil Corporation, have signed an MOU in March last year. So that has sort of enabled in the launch of this project called Project Chandana, Comprehensive Healthcare for Anemic and Sickle Cell Disease population, tribal in Karnataka, in these 3 districts. So by closely working with the Government of Karnataka, with the support of CSR support of Indian Oil Corporation, the whole comprehensive care, right from sensitization and generating the awareness about the sickle cell to in terms of screening them, testing them, giving them the counseling, genetic counseling, to sort of the marriage counseling, and for the diseased people, then the support and medication, treatment, follow-up, all these aspects, end-to-end holistic comprehensive care is being offered. There are people who were identified after hospitalization or before. There are a good number of people who were identified before they had these kind of any serious complications manifested. In all those cases, during the awareness itself, we started giving them the IEC activities and these sensitization and awareness camps, school at different levels, also schools and community levels, and then public level and so on. They are being told about eliminating these social stigma and socio-psychological issues involved in letting them know that they are sickle cell people, and the misconceptions and so on, right? So are getting addressed, and then the counseling is being offered, and those SCD patients receive a lifelong treatment. So this is not something that can be cured as of now, and but just like diabetes, they are put on this hydroxyurea medication. Then it enables especially children who have been receiving and continue to receive this medication, can prevent disability, lifelong disability. And also, if they are not detected, in fact, almost 45% to 50% usually even die before they reach 12 years of age, right? So significantly helps in preventing these things and better management of the condition. From a awareness camps and sensitization now is sort of making them really aware that nothing to worry, even if they have, this is just like any other disease, that they can lead a good quality life and they can just get tested from a simple finger prick, nothing to worry about. In fact, also large volumes of blood being drawn and a whole lot of complex process and so on there, and then itself in terms of the right government officials who are offering this support in terms of sub-center level and primary health center level, they get to know and then they can offer the right support needed, and ASHA workers can continue to sort of coordinate them. And also in terms of prevention is better than cure, right? In terms of this is passed on from genetically from parents to the next generations. So the kind of simplified counseling with the counseling cards, genetic counseling cards and so on. So it's a simple overlap that they see between the two people's card, and then just like this is like a genetic Kundalini match. They can get to see the compatibility between the prospective couple, and then can take a call. And even if they marry also, that awareness is helping them to take the right care right from the conception to delivery, and then taking care of the child, so that the possibility of preventing the lifelong disability for the child, or premature death or early loss of child initial few years itself, that kind of awareness is significantly helping them to, one, the possibility of minimizing chances of passing on to the subsequent generations, and two, nothing to worry, just we continue to take the medication, and then it helps in managing it for those who are already diagnosed and seem to having it issue, and before leading it into more serious and severe consequences. Unless this is a solution is made into comprehensive to touch on various aspects, it cannot in fact go and easily impact as well. Is not just focusing on technology, not just focusing on a test, because when we look at from the tribal population, our subjects, individuals, from their point of view, it is immaterial what is this XYZ, what it does, how it does, right? So it's their life, and from that point of view, how does it make an difference in their lives and their community and their families, has to be really felt by them, understood by them, and seen by them, so that then they can actually take it forward. And that's where it has really helped. But I would say this is tip of an iceberg, in the sense very, very scale at which this is yet to impact or serve the society is significantly high, but it has given a whole lot of satisfaction as researchers, especially going through this journey, has opened up our eyes, got to know a whole lot of things, and dealing with very diverse stakeholders in itself a very enriching experience for us.